wheeled in a wheelchair. And the same goes for the Johns Hopkins. I was told that I was more fortunate, which obviously puts things into a lot of perspective, because I don't feel particularly fortunate, but I do know that it could be a lot worse.
And we'll have more from Diane's interview with James in subsequent newscasts. Well, Bermuda is in the grips of a health crisis, one that began long before COVID-19. Gray Minor spoke with Dr. Amani Flood about the island's diabetes epidemic.
COVID-19 has taken a toll on Bermuda, negatively impacting the social, economic, and physical well-being of the island's residents, compounding the country's pre-pandemic health crisis, most notably diabetes and obesity. I spoke with North Shore Medical's Dr. Amani Flood to find out what small but significant steps individuals can take to ensure their journey to good health is on the right track.
Hi, Gray. The small but significant steps that people can take are to return to their healthcare provider and resume their annual healthcare exams, refill their prescriptions, and be tested for ongoing and for new conditions. You know, COVID made us pinpoint focused on the value of good health. So let's begin correcting the bad habits we've developed. Lose that excess weight, go back outside for daily activities and fresh air, and put away the lockdown snacks. So those who can, in my opinion, should return to the workplace where you can interact with others, because that's extremely important for mental health.
Dr. Flood is currently hosting a series of Zoom-based online health education seminars to help Bermuda regain lost ground in their battle against poor health. She says that the unforeseen consequences of COVID have had a ripple effect across society.
Gray, the COVID pandemic had so many unseen victims because of the stresses and the limits placed on the healthcare systems. Patients were not receiving the care they are needed for their chronic ongoing conditions. New diagnoses went undiscovered. And it may take years to really fully corroborate this, but I think it's reasonable to assume that, yes, the pandemic has resulted in far more unintended consequences than we know, and will probably continue to contribute to morbidity and mortality that's even unrelated to COVID for years to come. To reverse this trend, my suggestion and what we're doing at North Shore Medical is reaching out to our patients and to the public at large to say, hey, come back to healthcare. Come back to be assessed and treated for the conditions you had prior to COVID. Medical practitioners should really lead the way in this regard by reaching out to their patients and letting them know that it's safe to come to the office and that they are welcome to come in and that they should come in. So our new initiative of offering online health education supports that proposition by reminding people that there is still a need to manage their health conditions outside of the COVID pandemic.
To find more information on or to register for Dr. Amani Flood's education seminar, including tomorrow's session on weight loss, call 293-5476 or visit nmac.bm. Gray Miners reporting for Bermuda Broadcasting News.
Thanks, Gray. Let's head over to